opiates and opioids, and sedative hypnotics. Next week, I think we're talking about alcohol. So here we go. Maybe. There we go. Opiates and opioids. Depressants depress the activity in the central nervous system. That's why they work. They sedate, they cause muscles to relax, they may depress inhibitions, they may change your emotions, they may change your impulses. They mimic the natural inhibitory neurotransmitters of endorphin, enkephalin, and gamma aminobutyric acid, also known as GABA. Three major classes of downers: opiates, opioids, sedative, hypnotics, and alcohol. Of course, we're going to talk about alcohol next week. Four minor classes of depressants: skeletal muscle relaxants, antihistamines, over-the-counter depressants, and look-alike depressants. Opiates and opioids include opium, morphine, codeine, hydrocodone, also known as Vicodin, oxycodone, also known as OxyContin, methadone, and heroin. Originally developed as painkillers and cough suppressants and diarrhea treatments, these are now being used to get people high, and they're overdosing. Sedative hypnotics are synthetic chemicals developed to treat anxiety and insomnia. Naproximate, also known as Miltown, phenobarbital, Seconal, Doradin, methaqualone, also known as Quaaludes, flintrazepam, also known as Rohypnol or Roofies, GHB, and benzodiazepines of Xanax and Valium. The two drugs that are used as date rape drugs are Rohypnol and GHB. Roofies and GHB. Ketamine is also used as a date rape drug. Alcohol is the natural byproduct of the fermentation process of plant sugars or starches. This is the oldest psychoactive substance used by humans. Alcohol is the world's second most destructive drug after tobacco. Skeletal muscle relaxants are synthetically developed central nervous system depressants that target the area of the brain responsible for muscle coordination and activity. Soma, Paraffin Forte, Flexeril, Lioresal, which we don't really use in the United States very much, and Robaxin. Okay. Antihistamines found in cold and allergy medications to block the neurotransmitter histamine. It's a synthetic drug used to treat allergic reactions. It prevents ulcers. It prevents shock. It prevents rashes. It prevents motion sickness. It prevents symptoms of Parkinson's disease. Antihistamines. Over-the-counter depressants are sleep aids or sedatives. Nitol, Sleepies, and Sominex are common sleep aids. Active ingredients include scopolamine, scopolamine the truth serum, antihistamines, bromide derivatives, and alcohol. That's why they work. Lookalike depressants are rarely seen today, so this is something we aren't worrying about at this point. Opiates are products of the opium poppy. Opioids are synthetic versions of the opiates. Opiates come from the milky sap that oozes from the unripe seed pod of the flower. It will ooze for about a week. It can be milked about 6 times in any given season. And as you can see, that's the way it looks. You take a knife and you just slice it open and it just oozes this white substance. Opium products over 25 alkaloids, the two most important are codeine and morphine. Codeine makes up 0.7% to 2.5% of the opium exudate. Morphine makes up 10 to 20% of the opium exudate. A third alkaloid that is a stimulant rather than a depressant is thebaine, that we can also get from opium, from the opium poppy. Semi-synthetic opiates are opiates that are refined in a select way to produce a psychoactive substance that is partially natural and partially synthetic. And these include heroin, hydrocodone or Vicodin, oxycodone, Percodan or OxyContin, and hydromorphine, also known as Dilaudid. Fully synthetic opiate-like drugs are methadone, meperidine, also known as Demerol, and propoxyphene, also known as Darvon. Synthetic opioid antagonists, naltrexone and naloxone. And this is how we block the opioids and opiates from killing you when you overdose. Opium poppies were first cultivated in ancient Mesopotamia, then spread north to Greece and west to Egypt, eventually making its way east into Asia. Opium was used in many medicines in the world, in the old world, but its ills were seen even then when various writers wrote of its addictive properties. Opium tended to be used as an additive, as an additive, or eaten or chewed or mixed with liquids and drunk. In the early 1500s, opium regained popularity when the Swiss chemist Paracelsus began making a tincture. Tincture means that they mixed it with alcohol with opium powder, and that was known as laudanum. He used laudanum to treat dysentery, pain, diarrhea, and coughs. Opium continued to be used in medicinal mixtures for the next 3 centuries. Paregoric, a tincture of opium with camphor, was developed for the treatment of diarrhea. This mixture is still used today. As a matter of fact, when my mother had gallbladder disease, she was given paregoric to control her diarrhea. Opium smoking became popular in the 16th century. This means of drug introduction puts more of the active ingredients into the system faster, about 7 to 10 seconds. Because the psychoactive ingredients enter the bloodstream and brain faster, this is a greater sense of euphoria, well-being, and relaxation. Modern methods of smoking heroin involves heating the substance in tinfoil and inhaling the fumes through a straw. This is known as chasing the dragon, and that's what it looks like. In 1805, the morphine alkaloid was first isolated from opium and was found to be 10 times stronger than opium and thus a more effective painkiller. Morphine was first used in the Crimean War from 1853 to 1856, and then during the American Civil War. Now, the Crimean War, you know where it is. It's just south of of Ukraine. It is fairly controversial at this point because the Russians have taken it over, and the Ukrainians weren't real happy about it. And now, as far as the war goes, it's possible the Ukrainians could get it back, and that's questionable as to whether that's going to happen. But that's where Crimea is, just south of the Ukraine, in the Black Sea. Opium poppies were actually grown in the South to provide morphine for the Confederate troops, and this is during the American Civil War. In 1832, the weaker alkaloid codeine was isolated from opium. It was found only be twice as strong as a painkiller as opium. Codeine was used to treat coughs and general neuralgia. In 1874, a British chemist boiled morphine with acetic anhydride to create an opiate synthetic that was 5 to 8 times stronger than morphine. Bayer Pharmaceuticals of Germany bought the chemical and named it heroin. Its effects were heroic on the individual. Bayer marketed it as a cough suppressant, chest painkiller, and a treatment for tuberculosis and pneumonia. Heroin crossed the blood-brain barrier more rapidly than morphine. The result was a more intense and rapid rush and euphoria. It is estimated that at the turn of the 20th century, there were between 250,000 to 1 million morphine and heroin addicts in the United States. Through the 1800s, patent medicines were produced that contained opiates. These patent medicines were used for such problems as tired blood, colicky babies, coughs, diarrhea, and toothaches. They were used to quiet loud children and to aid in sleeping. Surprisingly, surveys showed that more than half of the opium addicts were women, about 56 to 71% of the addicts. Famous opiate addicts of the 19th century: Jane Addams, Sarah Bernhardt, Elizabeth Barrett Browning, Charlotte Bronte, one of the famous Bronte sisters, Louisa May Alcott, Samuel Coleridge. Wait a minute, you don't know who these people are, I'm guessing. She was the first social worker, Jane Addams. Sarah Bernhardt was an actress. Elizabeth Barrett Browning was a poet and a writer. Charlotte Bronte was an author. Louisa May Alcott was an author as well. Samuel Coleridge was a poet. Charles Baudelaire was a poet and an author, French author and poet. Lord Byron was an English poet. John Keats was an English poet. Edgar Allan Poe, of course, was an author and poet from the United States. Algernon Swinburne was a poet. Opium, morphine, and heroin became a health concern in the United States around the turn of the 20th century. In 1906, the Pure Food and Drug Act was passed limiting the manufacture and use of opiates. In 1914, opiates became the first drug considered a narcotic in the Harrison Narcotics Act. By 1924, heroin production was outlawed in the United States. In 1915, only 63 people incarcerated in federal prisons were incarcerated for narcotics violations. By 1928, 1 out of every 3 people were incarcerated because of narcotics violations, up to 2,529 prisoners. By 2004, 86.5% of the federally incarcerated prisoners had been convicted on drug offenses. That's 155,900 prisoners out of 180,328. Because of the market for opiates in the United States, criminal organizations sprung up to supply the demand. Chinese triads, the mafia, the French Connection, Mexican narcotraficantes, African traffickers, Russian mafia, and Colombian cartels. So we have people from China, from Italy, from France, from Mexico, from Africa, some areas of Africa, Russians, and Colombians. At present, 4.6 million Americans use opioids illicitly every month. Only 136,000 to 800,000 of these individuals are heroin users. 3.5 million people in the United States have tried heroin. The rest are prescription drug abusers. Oxycodone, also known as OxyContin, and hydrocodone, also known as Vicodin. A wrinkle that is appearing in the Dallas area junior and high schools is cheese, a mixture of a little Mexican brown heroin and over-the-counter medications containing antihistamines. The mixture gives the individual a rush. Several deaths have caused a nationwide scare over this stuff that looks like Parmesan cheese. Worldwide, 5 to 10 million people are regular heroin users. The United States only consumes about 3% of the heroin produced. The areas that are affected the most are Europe and Asia. 92% of the world's heroin is produced in Afghanistan. Most of the world's legal opium for pharmaceuticals is grown in India. Most of the heroin coming into the United States comes from Mexico. Medically, opioids are prescribed to deaden pain, to control coughing, and to stop diarrhea. Non-medically, opioids are used to drown out emotional pain, get a rush, induce euphoria, and prevent withdrawal symptoms. Pain is transmitted to the central nervous system through the neurotransmitter substance P. And of course, the P stands for peptide, not pain. The more substance P that is released in the synaptic cleft, the greater the pain. The body modulates the intensity of pain by blocking substance P receptor sites with endogenous painkillers, endorphins, enkephalins, and dynorphins. The endogenous painkillers occupy the substance P receptors, opioid receptors, referred to as mu receptors, kappa receptors, delta receptors, and non-opioid sigma receptors. Exogenous opioids work because they occupy the opioid receptors, acting as if they were endogenous painkillers. Endogenous painkillers are also activated when an individual feels anxious, to decrease anxiety, to produce a sense of detachment, to make the individual feel drowsy, to deaden the unwanted emotions. These effects occur because of the inhibiting effect of the endogenous or exogenous painkillers' effects on the locus coeruleus. And that is the locus coeruleus right there. Opioids induce pleasurable feelings by slotting into receptor sites meant for endogenous painkillers, inhibiting the action of GABA, triggering glutamate receptors enhancing dopamine neurons in the reward reinforcement pathway, increasing the release and enhancing the effect of dopamine. Heroin has the strongest effect of all the opioids. The reward reinforcement pathway performs two functions. It signals pleasure so that an act is more likely to be repeated. It signals alleviation of pain. Research has disclosed that relief of pain is a stronger incentive than the introduction of pleasure. With psychoactive drugs, especially opioids, the desire to prevent withdrawal symptoms is a stronger incentive for continued use than the desire for pleasure. When an individual is prescribed opioids, a non-abuser will use the medication until the pain relief threshold is found. An abuser will also use beyond the pain release threshold, searching for an emotional high. Chronic users of opioids will use a drug in excess to prevent the withdrawal symptoms they are seeking to return to the normal state, of course. Opioids, like receptor sites, have different functions. Mu and sigma receptors trigger the reward reinforcement pathway. They block pain transmission. They change mood. They cause pupil contraction. They depress the autonomic nervous system, which controls respiration and blood pressure. Kappa receptors induce dysphoria, induce endocrine changes, and control pain at the spinal cord level. Opioids suppress coughs by blocking the activation of the cough center in the brainstem. Codeine and hydrocodone-based cough suppressants are still widely used. They include Robitussin HC and Vicodin syrup. People will abuse these substances for the psychedelic effects. Unfortunately, an overdose of the psychedelic substance dextromethorphan can cause respiratory suppression, nausea, and vomiting. Overdose of cough suppressants is usually in combination with other depressants such as alcohol, benzodiazepines, and antidepressants. Opioids are also given to control diarrhea. Opioids works on the brainstem to inhibit gastric secretions and depress the activity of the gastric muscles. Opioids addicts may suffer from severe constipation, which is always a problem with anytime you're taking opioids is constipation. Thank you. Opioids affect every part of the body, but especially your heart, your lungs, your brain, your eyes, your voice box, muscles, cough center, nausea center, reproductive system, excretory system, and the immune system. Physical side effects of opioids, but especially heroin, include insensitivity to pain, lowered blood pressure, lowered pulse, lowered respiration rate, and confusion. As stronger doses of opioids, but especially heroin, might cause droopy eyelids, nodding head, slowed, raspy speech, slowed coordination and walking gait, pinpoint pupils, histamine release causing itchy, dried skin, suppression of cough center hindering the clearance of phlegm, vomiting due to the activation of the nausea center, severe constipation, delayed menstruation, reduced testosterone production in males, and dulled sexual desire to the point of indifference. So when somebody comes in and we think that they may have a heroin overdose or a fentanyl overdose or whatever kind of overdose we're thinking about, any kind of opioid overdose, what we look for is pinpoint pupils. That's what we're looking for. If we see pinpoint pupils, we're pretty much sure that we need to hit this person with a little bit of naloxone. Tolerance for opioids occurs when the body tries to neutralize the toxin. It does this by speeding up metabolism, especially in the liver, desensitizing the nerve cells that the substance affects, increasing drug excretion by increasing urine, feces, and sweat output, alteration of the brain chemistry to compensate for the effects of the drug. Opioids tolerance is very rapid, and the individual might multiply their dosage 10 times in 10 days to get the same effect. Now, a lot of times when people come into the emergency room and we start treating them, the sweat just starts pouring off of them. It's really kind of weird, and it's got a really strange smell too. It isn't like, body odor. It's kind of metallic. It's really weird. Chronic use of opioids can cause, of course, everybody has a different odor, but by golly, all those guys smell kind of the same. Chronic use of opioids can cause permanent changes in the brain. Animal studies show that heavy usage of opioids will reduce the dopamine-producing cells in the ventral tegmental area by 1/4. Hence, these individuals have less of an ability to feel pleasure or even feel normal, another reason to take the drug. At this point, the body relies on the drug to feel normal. Withdrawal from opioids may take place in 3 stages. Acute withdrawal, the body tries to return to normal too quickly. Post-acute withdrawal, subtle emotional and physical symptoms such as mood swings and sleep problems that may persist for 3 to 18 months after use of the drug. Protracted withdrawal, more severe emotional and severe symptoms that may start after the first month and last into the 30th week. Decrease in blood pressure, decrease in body temperature, decreased respiration, feeling of general uneasiness. This reaction might be triggered by environmental cues that incite memories and their addictive life. These cues can persist for decades after cessation of use. Short-acting opioids, 2 to 3 hours, result in more acute withdrawal symptoms that may begin 8 to 12 hours after chronic use. These include heroin, morphine, and hydromorphone or Dilaudid. Withdrawal peaks at 48 hours and lasts for 5 to 7 days. Long-acting opioids will delay the withdrawal symptoms for 1.5 to 3 days. These include methadone and LAAM. Levoalpha-acetyl-methadol. Peak withdrawal hits at the 4 to 6 day, and recovery may take as long as 2 weeks. Opioids that resemble codeine have a withdrawal pattern that is somewhere between the short and the long term opioids. Codeine, oxycodone, OxyContin, also known as OxyContin, and propoxyphene, also known as Darvon. One of the curious withdrawal symptoms of opioids is hyperactivity. This is caused by a sudden release of an excess amount of norepinephrine. Norepinephrine release is inhibited by the opioids. All in all, people rarely die from opioids withdrawal, as they may do with alcohol or sedative hypnotic withdrawals. The results are similar to a severe case of the flu. The problem with opioids withdrawal is that the fear of the withdrawal, since this is the area of the brain that is most affected by the drugs. Neonatal effects of opioids usage are extreme because the drugs readily cross the placental barrier. Pregnant opioid users are at greater risk for miscarriage, placental separation, premature labor, breech birth, stillbirth, and eclampsia. And as I told you, my great niece had a baby that was addicted to heroin, and it took him about 6 weeks to detox. If the fetus survives these dangers, it will be just as addicted at birth as its mother is, though due to size and dilution factors, the withdrawal symptoms are more severe. Low birth weight, high-pitched cry, irritability, tremors, exaggerated reflexes, diarrhea, rapid breathing, sweating, vomiting, sneezing, yawning, and hiccuping. If the neonate survives the withdrawal, the effects will last 5 to 8 weeks. In the early 21st century, 4,000 to 5,000 people died from opioids overdose every year. Last year, 130 people died from opioid overdoses every day, which amounted to 47,450 people in 1 year. 14 million drug-related emergency room visits occurred in 2017 related to opioid overdoses. In one study, only 57% of the opioids were accidental. What opioid overdose look like? Blood pressure drops. The heart isn't beating rapidly enough to circulate your blood. Because the heart isn't beating, the lungs fill up with fluid resembling drowning. The lips turn blue as the hue begins to imbue the entire body, and this is known as cyanosis. The pupils become pinpoint. Respiration begins to rasp and rattle. They go into convulsions as much from the lack of oxygen as the toxins. And remember, this is like drowning. Tony Hawkins, drummer for the Foo Fighters, overdosed on opioids, benzodiazepines, tricyclics, and marijuana, THC. Juice WRLD, a rapper, overdosed on Percocet. China, the pro wrestler, overdosed on oxycodone, oxymorphone, temazepam, and diazepam. Corey Monteith, overdosed on heroin and alcohol. Mac Miller, American rapper, died of an overdose of fentanyl, cocaine, and alcohol. Art Bell, American broadcaster, died of an overdose of oxycodone, hydrocodone, diazepam, and carisoprodol. This is Peaches Geldof. She was the daughter of Irish rocker Bob Geldof. She was a television celebrity and presenter, and she had a column. She was a model at one point, having witnessed her own mother overdose when she was 11 years old. She also overdosed on heroin in front of her 11-month-old son. So just like daddy, okay, or just like mommy, actually. Death by overdose is one way to die from opioids. Another is to contract a disease from sharing needles. According to research, 50 to 90% of IV heroin users carry the hepatitis C virus. A look at individuals who have only shot up for a year shows a rate of 71.4%. 20 to 80% of those infected will develop liver disease. 4 to 16% will develop liver cancer. 50% of all IV drug users are HIV positive. 25% of all U.S. HIV/AIDS cases were transmitted from the contaminated IV drug users. 3/4 of these individuals are male. 7 to 10% of the HIV/AIDS cases in the United States were transmitted through sexual contact with heterosexual or homosexual IV drug users. 70% of children with HIV had mothers who were IV drug users, or the sexual partners of individuals who were IV drug users. IV drug abusers will do just about anything to get their fix. Heroin fairly quickly scleroses the veins being used for injecting so that the individual has to go to more and more difficult sites for their fix. Sclerosis means hardening of the arteries because you stick it with a toxin. And normally we draw in the antecubital area in your elbow, in the inside of your elbow. But these guys will go to their wrists, they'll go between their toes, and there is a pretty nice vein between your toes. They'll go in the neck, which is a bit tricky because you have to look in the mirror and everything's backwards. The males will even go on their dorsal vein in their penis. Anything for a fix. Heroin users may inject themselves 6 times a day, and sanitation is rarely the top priority. Septic abscesses and soft tissue ulcerations are often the result of unsanitary practices. Because the individual is immunocompromised by the drugs being used, the severity of the infections are sometimes catastrophic. Sometimes they will contract Staph aureus, which is a common infector, and or beta strep group A, which anytime it gets onto the skin, it wreaks havoc. That's what it looks like. Ain't it pretty? There are several conditions that are more common among IV drug users than non-users. Necrotizing fasciitis is the condition where a virulent bacteria gets under the skin and eats tissue away. Endocarditis, bacterial infection of the heart valve, and cotton fever, short-term bacterial infections. 58% of the people entering treatment for heroin addiction have been injecting the drug. Drug usage tends to start at different ages. The mean age for alcohol use is 16.4. The mean age, that would be in your sophomore year. Is that right? Or, yeah, so into your sophomore year, I guess. The mean age of the first tobacco usage is 17.3. The mean age for marijuana usage is 17.4. The mean age for heroin first usage is 22.2. From first usage to daily habit averages about 1 year of sporadic usage. Research following a group of 582 heroin abusers for 33 years with an average starting age of 23.4 found that after 33 years, more than half were dead, 50 to 100 times greater than the general population. They died of overdose, they died of accidental poisoning, they died of homicide, suicide, accidents, liver disease. 44% still used heroin, 67% used tobacco, 22% were daily alcohol users, 35.5% used marijuana, 19.4% used cocaine, 10.3% used crack, 11.6% used amphetamines. The group reported high rates of mental health and health problems. The group that now averaged 57.4 years reported frequently interactions with the criminal justice system, and that isn't fun. Morphine is metabolized by the liver. 3 to 6 times the morphine must be ingested to get the same effect as an individual gets from an injection. Morphine will be detectable in the urine for several days after ingestion. 1 out of every 6 Americans has a chronic pain problem due to arthritis, back injury, cancer, burns, severe tissue damage, severe nerve damage. Some medical facilities spend over 1/3 of their appointment time dealing with chronic pain issues. In one research of chronic pain sufferers, 72% had suffered for more than 3 years, and 34% suffered more than 10 years. From this research, about half were afraid to use opioids, muscle relaxants, or sedative hypnotics because Fear of tissue dependence and addiction, fear that the painkiller would mask more serious diseases, fear that they might be thought of as drug seekers trying to supply a habit. Risk factors in morphine addiction includes kidney and liver problems, drug abuse history, medical drug usage, mental health history, hereditary factors that make the patient more susceptible. Codeine is used for cough suppression, as we said earlier. As a cough suppressant, it is a Schedule II drug, and when it is mixed with another drug for pain control, it is a Schedule III drug. Codeine was the most widely prescribed and abused opiate in the United States. Its number one ranking has since been taken over by Vicodin, or hydrocodone. Pimp C and Day-G Screw died from cough syrup overdoses in the LA club scene. Cool. Hydrocodone is also known as Vicodin, Hycodan, Tussin, and Norco. This is a Schedule III drug. 120 million prescriptions were written for Vicodin in 2006. Abuse of this drug usually is precipitated after the drug has been prescribed legally. Heavy abuse has been known to cause hearing loss. 600 deaths a year are caused from hydrocodone overdose, usually when the narcotic is used with other depressants. Methadone, Darvon, and Demerol were developed in German laboratories during World War II when the Axis powers were cut off from their supply of opium to provide painkillers of similar caliber to morphine. Methadone is less powerful than morphine and lasts longer in the individual's system. Methadone is authorized in the United States as a treatment for heroin addiction. There are 1,292 methadone treatment programs in the United States with 228,000 heroin addicts, which means you can take, you probably never come back anyway. Hydromorphone is refined from morphine, and gram for gram is 7 to 10 times more potent than morphine. Because of its potency, hydromorphone is stringently controlled. Oxycodone is a semi-synthetic derivative of codeine and is used for moderate to severe pain. This drug is supposed to be taken orally. The effects begin after about 30 minutes. The effects last 4 to 6 hours. It is a stronger drug than codeine, but weaker than both morphine or Dilaudid. This drug can be abused by chewing or crushing and injecting or sniffing the resulting drug. The manufacturer of the drug has tried controlling abuse by reducing the strength of the tablet. Demerol has been around longer than most of the synthetics and semi-synthetics. It is 1/6 the strength of morphine, but is widely used as an injectable anesthetic. It is in large doses, Demerol can cause sedation and euphoria, which makes it ideal for surgery because it doesn't suppress coughing or have the side effects of constipation. This drug is the most widely abused by medical professionals. Weak opioid antagonists. Talwin is a weak opioid antagonist as well as an agonist. When used in combination with other antihistamines, the drug is reputed to give a heroin-like high. Manufacturers have mixed the drug with naloxone, the opioid antagonist, to reduce the use as an opioid accelerant. This drug is rarely used now to get a high. Propoxyphene is also called Darvon, Darvocet, Propocet, and Wygesic. It is used for mild to moderate pain relief. This drug metabolizes slowly and so can lead to overdose or addiction if not monitored. The drug is sometimes used as a replacement opioid for heroin treatment in place of methadone. Only 4% of the overdose deaths using opioids have been seen with propoxyphene. Fentanyl was the most powerful of the opioids as it is 50 to 100 times stronger than morphine. It is used in pre and post surgery to alleviate excessive pain. It also now comes in a patch for chronic severe pain and in a lollipop. There is also an oral transmucosal tablet called Actec, meant to be dissolved in the mouth. Street chemists have been able to replicate the structure of fentanyl with a powerful drug called China White. Unfortunately, some of the street drug contains MPTP, which kills the dopamine-producing cells in the brain, resulting in Parkinson's disease at best, and at worst, a frozen addict who can't move for the rest of their lives. Fentanyl overdose deaths: Prince, Tom Petty, Michelle McNamara, Mac Miller, the rapper, he overdosed on fentanyl, cocaine, and alcohol. Lil Peep overdosed on fentanyl and Xanax. As if fentanyl wasn't killing off enough people, the Food and Drug Administration has approved Suvia, which is 10 times stronger than fentanyl and 1,000 times stronger than morphine. The drug is so strong that coming in contact with its dust from manufacture can cause an instant overdose. LAM, levomethyl acetate, is a long-acting opioid that is used for heroin replacement therapy. LAM lasts for 2 to 3 days, whereas methadone lasts for only 1 to 2 days. Because it only has to be taken every third day, take-home doses are unnecessary, as is the case with methadone. LAM metabolizes in the system too slowly for the drug to be used for pain management. LAM is more tightly controlled than methadone, and despite its success in treating heroin addicts, the paperwork involved makes it an unattractive alternative than the more widely used methadone. Naloxone and naltrexone are opioid antagonists, blocking all the exogenous and endogenous opioids. These drugs can be given to people who have overdosed on opioids, blocking the deadly effects of the opioid structure. Unfortunately, naloxone is short-acting and has to be frequently administered to block the deadly effects of the opioid chemical. Naltrexone drives the effects of the opioid for up to 72 hours to help prevent relapse. Buprenorphine is a powerful opioid agonist at low doses, but at high doses becomes an opioid antagonist. At low doses, it is used as an analgesic substitute for morphine. It is 50 times stronger than heroin. At high doses, it has an inverse agonist effect and will block opioids from receptor sites for up to 30 hours. At high doses, it can be used as part of an opioid treatment regimen because it blocks the effect of the opioids while taking the edge from some of the side effects. Clonidine, or Catapres, is often used to diminish nausea, anxiety, and diarrhea from opioid withdrawal symptoms. It also reduces opioid craving. It reduces the overactivity of norepinephrine receptors and can cut withdrawal times in half. Used in conjunction with naltrexone, clonidine can reduce withdrawal recovery from 1 month to 5 days. Stadol and Ultram. These new synthetic opioids were developed as less abusable or addictive analgesics. These drugs are still abused and have been classified as a Schedule IV drug. Sedative hypnotics are any drug that relaxes and soothes the body and the mind. That's the sedative part. It eases anxiety or induces sleep, and that's the hypnotic part. That's why they call it sedative hypnotics. The two main categories of sedative hypnotics are benzodiazepines and barbiturates. An example of benzodiazepines would be alprazolam, or Xanax, and clonazepam, Klonopin. An example of barbiturates would be phenobarbital. Just under half of all the prescriptions for psychiatric medications are written for antidepressants. The first sedatives, or bromides, also used as anticonvulsants in the 1850s. The biggest problem with these drugs was the fact that they had a long half-life, so toxic levels could be built up in the body if it wasn't monitored properly. Around the American Civil War, chloral hydrate started being used as a sleep aid and a sedative. It was used to treat tension, pain, insomnia caused by alcoholism, and pregnancy neuroses. It was used as the original Mickey Finn to knock out men so that they could be shanghaied. What would happen is an individual would be drinking at a pub. They would drop this guy a Mickey Finn, and he'd pass out. Then they'd carry him to the boat, and he would become their sailor. They had a difficult time filling their rosters, their sailing rosters. In 1882, physicians began using paraldehyde to control alcohol withdrawal symptoms. It is still sometimes used to treat alcohol withdrawal symptoms, despite addictive properties and an unpleasant odor. Ugh. Barbiturates were first developed at the end of the 19th century, and their popularity peaked in the 1930s and 1940s. Barbiturates are any compound synthesized from barbituric acid, such as pentobarbital, sacobarbital, or phenobarbital. These substances are highly addictive and fairly toxic, making them fairly dangerous. Miltown, or meprobamate, was used fairly extensively as a sedative in the late 1940s into the 1950s. It became popular with housewives and came to be known as Mother's Little Helper. As a matter of fact, the Rolling Stones sang a very famous song about Mother's Little Helper. Less dangerous than barbiturates, it maintained its popularity until the 1960s when benzodiazepines were developed. Doradin, glutathione, was also used as a barbiturate substitute. Unfortunately, it was weaker than phenobarbital. It was just as addictive as barbiturates. It is no longer manufactured in the United States. Librium chlordiazepoxide was the first benzodiazepine developed in 1954. Along with diazepam, Valium, these two drugs dominated the sedative hypnotic market until the invention of Prozac. Throughout thought to be a good alternative to the highly addictive barbiturates, benzodiazepines proved to be very addictive themselves, just as dangerous withdrawals as barbiturates. Today, there are several new drugs that are being advertised as less addictive. Lunesta, Buspar, Rosarim, Ambien, Lyrica. Only Buspar and Rosarim have proven to be less addictive. Sedative hypnotics proved to be so addictive that their use waxed and waned over the years. At this point in time, benzodiazepines are used sparingly, and they have been replaced by psychiatric medications that are less addictive, and there is a lower possibility of adding them to other medications to get high. However, sedative hypnotics can still be abused if the drug is overused when prescribed by a physician. It is used in combination with other psychoactive substances for the synergistic or counterproductive set. The drugs are borrowed or stolen from someone as a form of self-medication. The drugs are obtained by other illegal means, for example, forged prescriptions or buying on the black market. The list of celebrities who have died from barbiturate overdoses is long. Marilyn Monroe had high doses of Nembutal and chloral hydrate in her system when she died, along with alcohol, of course. Dorothy Dandridge had high levels of tricyclic antidepressant imipramine, tofranil, when she was found. Jimi Hendrix was a notorious mixer of drugs. Hendrix had high levels of secobarbital in his system when he asphyxiated on his own vomit. The drugs were prescribed to his girlfriend, not to him. Bruce Lee, the quintessential martial arts expert, died from an allergic reaction to a painkiller containing aspirin and meprobamate. Freddie Prinze shot himself while under the influence of Quaaludes. Prinze was the star of the hit sitcom Chico and the Man. He was Chico. Elvis Presley was a notorious prescription pill mixer. When he died, he had 14 different drugs in his system, including codeine, Quaaludes, and methaqualone. Keith Moon was a drummer for The Who and an alcoholic when he tried to clean up. The drug he was using was the sedative clomethazole. He had 10 times the daily dosage in his system when he died. Abby Hoffman was a 60s anti-war activist. Hoffman was found with 150 tabs of phenobarbital in his stomach. His death was ruled a suicide. Steve Clark was the lead guitarist for Def Leppard. Clark was found by his girlfriend with respiratory failure from the use of painkillers, Valium, antidepressants, and alcohol. Margot Hemingway was an actress and a granddaughter of the iconic author Ernest Hemingway. Granddaughter Hemingway was found dead from an overdose of phenobarbital on the 35th anniversary of her grandfather's suicide. Rob Pilatus, Milli of Milli Vanilli, died of a heart attack induced by a sedative given to him to help him with alcohol withdrawals. He was taking the drug with alcohol. Bad idea. Dana Plato, the actress from the sitcom Diff'rent Strokes, died from a mixture of Soma, which is a muscle relaxant, and Vicodin. Plato had a long history of prescription drug abuse. Old Dirty Bastard, the lightning rod of the rapper band Wu-Tang Clan, died after mixing tramadol, which is a painkiller, with codeine. Chris Penn, an actor and brother of Sean Penn, died from a mixture of promethazine, which is an antihistamine, and codeine. The combination mixed with obesity created a fatal enlargement of his heart. Whoops, went the wrong way. R&B singer Gerald Levert died from a combination of Percocet, Vicodin, Darvocet, Xanax, and 2 antihistamines. Anna Nicole Smith, the blousy blonde and playboy bunny from Texas who shocked the world by marrying a one-foot-in-the-grave billionaire, died with 11 drugs in her system, including Ativan, Cirax, Klonopin, chloral hydrate, Lexapro, Valium, Noctec, and Zoloft. Posthumous Academy Award winner Heath Ledger died with 6 drugs in his system: oxycodone, hydrocodone, Xanax, Valium, doxylamine, and temazepam. Michael Jackson had a number of drugs in his system when he died, but the combination that killed him were propofol, lorazepam, midazolam, and Valium. Officially, Corey Haim died of pneumonia, but the actor had been fighting drug addiction most of his adult life. He was found unresponsive with lethal doses of Valium, Vicodin, Soma, and haloperidol in his system. Amy Winehouse was a notorious drug experimenter who went through rehab several times before her death at 27. She had started several episodes of binge drinking and then abstaining before her death. She died of alcohol poisoning with an alcohol content of 0.416, which is really pretty high. Whitney Houston had been a notorious drug mixer most of her adult life. She was found drowned in her bathtub with high levels of cocaine, Flexeril, Benadryl, Xanax, and marijuana. Judy Garland had been a child star and had started a pattern of excessive workdays fueled by uppers and downers. At 47, she died of a secobarbital overdose. Philip Seymour Hoffman was a highly touted actor nominated for 4 Academy Awards, of which he won once. He died at 46 from an overdose of heroin, cocaine, amphetamines, and benzodiazepines. Tom Petty was a rocker for 4 decades. He died at 66 with 3 forms of fentanyl in his system, along with oxycodone and 3 types of benzodiazepines. Kurt Cobain was the iconic frontman for the alternative rock band Nirvana. While Cobain died of a shotgun blast, he had excessive amounts of heroin and Valium in his system when he died at 27. Jim Morrison was the lead singer for the San Francisco band The Doors. Morrison considered himself a poet and philosopher as well as a singer. Morrison died of a heroin overdose in his bathtub at age 27. Janis Joplin was a rock star from the late 60s and early 70s. She partied with such iconic figures as the Grateful Dead and Country Joe and the Fish. She died at 27 of a heroin overdose. Prince was a singer and songwriter from the 1980s until his death in 2016. His album Purple Rain is one of the most celebrated albums of the last 50 years. He died of a fentanyl overdose at 57. He actually died twice. He died on an airplane, and they landed right here where I live, in Moline, Illinois. I live near the Quad Cities. And they brought him back, and then he went back to Minnesota, and 3 days later, he overdosed again, died at 57. John Belushi was one of the major original players on Saturday Night Live. He played Joliet Jake Blues of the Blues Brothers. In 1982, Belushi overdosed on a speedball at 33. More heroin and cocaine. Good job. River Phoenix was a child actor from the late 80s who was headed for success. The star of Stand By Me, Indiana Jones and the Last Crusade, and Sneakers, he died of a speedball overdose outside a club in Los Angeles at age 23. Chris Farley was a comedian of NSL of Saturday Night Live fame. He starred in such movies as Tommy Boy and Beverly Hills Ninja. He died of a speedball overdose at 33, like his hero John Belushi. Wow. Lots of dead people. Sorry about that. But we got to understand, this stuff is just way too dangerous to be playing with. At present, benzodiazepines are the most widely used sedative hypnotics in the United States. Benzodiazepines vary in their half-lives and can cause tissue dependence. For this reason, they can be highly addictive with severe withdrawal symptoms. Most physicians only use benzodiazepines as short-term fixes for specific conditions. In order of usage, the most widely prescribed benzodiazepines are Xanax or alprazolam, 34 million prescriptions, Ativan or lorazepam, 19 million prescriptions, clondiazepam or Klonopin, 16.7 million prescriptions, diazepam, Valium, or 12 million prescriptions, temazepam, Restoril, 7.6 million prescriptions. Benzodiazepines are used to reduce symptoms of anxiety and panic disorder. They reduce anxiety and apprehension in surgical patients. They treat sleeping problems. They control skeletal muscle spasms. They control seizures. They dampen acute alcohol withdrawal symptoms. Side effects of benzodiazepine usage is very similar to alcohol. Benzodiazepines are most often abused in conjunction with other drugs as they are used to lessen the effects of withdrawal symptoms. Methamphetamines, cocaine, heroin. In one study, 100% of benzodiazepine addicts were addicted to other substances as well. The typical benzodiazepine abuser is a white, well-educated 30-plus female. Benzodiazepines work because they increase the effects of the inhibiting neurotransmitter GABA in the cerebellum, the cerebral cortex, and the limbic system. The stronger influence of GABA inhibits anxiety-producing thoughts and overstimulation of neural messages. Benzodiazepines are metabolized by the liver to produce more powerful metabolites. The original drug and the metabolites tend to stay in the body for an extended period of time because they are extremely fat soluble. Alprazolam, or Xanax, is used for generalized anxiety disorder, panic disorder, and depression. Triazolam, or Halcion, is used for short-term treatment of insomnia, 7 to 10 days. Diazepam, or Valium, is used for anxiety, skeletal muscle spasms, control of seizures. IV Valium is used as a sedative before surgery. Tolerance has to do with liver efficiency. Older individuals will have a stronger reaction than a younger person. Overdose of benzodiazepines can cause dementia-like symptoms in the elderly. Tissue dependence can occur with excessive use over several months or normal dosage over a year. Because of the drug's lipophilic properties, it has an affinity for fat. Even small doses over time can cause tissue dependence and addiction. Withdrawal from benzodiazepines can be severe and take several months to taper off from the drug. Symptoms include recurrence of original symptoms, magnification of symptoms, exaggeration of the recurrence of symptoms, true withdrawal caused by low GABA and excess epinephrine and norepinephrine. Onset of withdrawal begins after 1 day with short-acting benzodiazepines and lasts for 7 to 20 days. For long-acting benzodiazepines, withdrawal begins after 5 days and takes up to 28 days for the symptoms to subside. Rohypnol is a benzodiazepine that causes short-term memory loss and sedation. The drug has been used for short-term memory impairment and has been used as a date rape drug since the 1970s. Rohypnol has been banned in the United States along with GHB since 1996. These are also known as roofies. Buspar is commonly prescribed as an anxiolytic, that's an anti-anxiety drug, and in combination with the selective serotonin reuptake inhibitors to treat depression. Buspar does not increase GABA. This drug does not seem to cause addiction and is rarely abused. This drug cannot be used to treat seizures. Lunesta is a hypnotic drug prescribed for insomnia. The drug increases GABA production, leading to relaxation. This substance is only addictive when taken with another drug. Achlorovinyl is actually a chemical ether, Placidil. Chloral hydrate is actually 3 molecules of ethyl alcohol fused together. Both of these drugs are prescribed to induce sleep and have a long history of addictive use and toxic overdose. Chloral hydrate and Placidil. GHB is a rapid sleep inducer. GHB increases the body's level of growth hormone, HGH. Its effects are sedation, disinhibition, empathy, sensory enhancement, euphoria. Its effects last for 3 to 6 hours. These GBL and BD these drugs are metabolized into GHB. These two substances have been formulated into mint-flavored rave elixirs, Blue Nitro, Revivrant, Gamma G, Rimforce, and Insom X. There you go. Let's go out raving. Quaaludes effects are similar to those caused by alcohol and linger for 60 to 90 minutes. The sedating effect lasts for 6 to 10 hours. This is the drug that is often abused in South Africa. This is very popular in South Africa, Quaaludes, also known as Mandrax. Lyrica, this drug is used to treat nerve pain from the shingles or diabetes and can be part of seizure treatment. More recently has been used for the treatment of anxiety, sleep, and mood disorders. This substance is rarely abused alone. Rosarim activates melatonin receptors in the brain. Melatonin is a substance that helps maintain the circadian rhythm. Used for short-term treatment only. When taken with alcohol, the result can be toxic. These are the three drugs known as Z-hypnotics because they all start with a Z. These drugs are short-acting drugs with 1 to 4 hours of half-lives. Excess use causes nausea, headaches, diarrhea, drowsiness. These drugs are rarely abused except with other drugs. And that is the end of the slideshow. Now, I have to tell you that I fell asleep a couple of times while I was going through this. So if I said something that didn't make any sense, I was probably asleep. I'm laughing because I've been getting tired when I do these lectures lately. Anyway, maybe I'm breathing too hard, taking in too much carbon dioxide. Anyway, so I'll talk to you guys next week. We'll tackle alcohol next week. Sorry about all the dead celebrities.